welcome everyone. We're glad you were able to tune in tonight for this, our sixth in a series of exploring the COVID pandemic and getting the chance to visit and hear from our frontline medical experts, our doctors and our nurses, as far as how to kind of navigate this pandemic. I'm the moderator tonight. I'm Patrick Canty, publisher of the Odessa American. And once again, it's an honor to be participating in this discussion. We have to thank, first off, Ravi Shakamuri of Star Hospice. Ravi moved here in the 90s and started Star Hospice. It serves about 11 county region of West Texas. And this is his brainchild. He came up with the idea of doing these kind of Zoom chats so that more people out there could hear from doctors and nurses and the frontline people fighting the pandemic and get more of their questions answered, kind of by this pandemic. And so tonight, what we're going to be talking about is, I guess you could say in a way that we're kind of seeing light at the end of the tunnel. The vaccines are starting to roll out and they're going into the arms of a lot of people, and not only in our community, but nationwide and around the world. So tonight what we're going to do is talk more and learn more about all things vaccination with the COVID-19 virus. And to help us better understand that, we have three outstanding physicians from our community that have really been doing a lot of great work in treating not only patients, but also helping people get the shots so they can try to kind of get back and live normal lives, so to speak. And I'd like to introduce them now to you. First off, we have Dr. Jayam Naidu, an internal medicine physician practicing for more than 42 years in Odessa. He's a local institution. He's also president of Naidu Clinic. He has been appointed by Governor Greg Abbott to the Texas Medical Board. He is also an assistant clinical professor at Texas Tech Health Sciences Center at the Permian Basin, a member of the Texas Medical Association, the Ector County Medical Society, the Texas Tech Health Sciences Center Advisory Board, and a past member of the Odessa Chamber of Commerce, as well as a former gubernatorial appointee of the Chronic Kidney Disease Task Force. Welcome, Dr. Naidu. Next, we have Dr. Suresh Prasad. Dr. Prasad has been in practice in Odessa for more than 20 years. He's board certified in internal medicine, sleep medicine, obesity medicine, and diabetes. He is a clinical hypertension specialist, American Society of Hypertension NCQA certified, and diabetes physician recognition program member. He is also an assistant clinical professor at the Health Sciences Center here in Odessa. He's a fellow of the American College of Physicians and a member of the Texas Medical Association. Ector County Medical Society, he's also a member of that, and he's been dealing extensively with COVID-19 patients throughout this pandemic. So glad to have you back again, Dr. Prasad.
Thank you.
And finally, we have Dr. Madhu Pamganamamula, who moved to Odessa 20 years ago. It seems like it was just yesterday, Doctor. He moved to Odessa after completing his residency in internal medicine from Temple University in Philadelphia, and was introduced to the community by Dr. Naidu. He serves as the medical director of a comprehensive cardiometabolic and research center known as the Center for Hypertension and Internal Medicine. Besides being a board certified physician in internal medicine and sleep medicine, he has been recognized as a certified specialist in hypertension, obesity medicine, diabetes, lipidology, and clinical densitometry. He is also a certified physician investigator and has served as principal investigator for several clinical research trials. Besides the hospitals, his team at the clinic administered more than 570 doses of the Moderna vaccine just in the past few weeks since its approval. Thank you, Dr. Madhu, for joining us, and thank you all. I think what we'll do first to kick this off is, I think we have a kind of a slide presentation to kind of show us the ins and outs of the new vaccines and how they work and related issues. And so I'm going to send it to you, Dr. Prasad, to get us started with that presentation.
Thank you, sir. Good evening, everyone. Maybe we can have the first slide first. And so first of all, I'm going to start talking about what the vaccination is. So basically I
Let's see, coming up, there it is.
Perfect, yeah. So the vaccination is basically a simple, safe, and effective way of protecting people against harmful disease. It uses your own body natural defense to build resistance to a specific infection and make your immune response stronger. Because the vaccine contain only killed or weakened form of germs or viruses, they do not cause a disease or put you at the risk of infection or its complication. So in the first slide, you can see, we have all been vaccinated with flu, measles, and chickenpox several times. But COVID being a new virus, we needed to have a vaccine. So the first time the coronavirus was detected in December 2019. Genetic sequencing was done in January 11, 2020. And because it was a pandemic, it triggered an urgent international response to prepare for outbreak and accelerated development of preventive vaccines. More than 50 vaccines candidates were in clinical research. National Regulatory Authority has approved about 6 vaccines so far for public use, out of which only 2 vaccines are available in our area. The next slide, please. Prior to COVID-19, the vaccine for infectious organism would take several years to get approval. The urgency to create a vaccine with a huge financial investment and scientific collaboration led to a compressed schedule that shortened the standard vaccine development in time. This means that some steps in the research and development process have happened in parallel while still maintaining the strict clinical and safety standard. Next slide, please. So we have already gone through the exploratory, preclinical, and all those. So there was, so these are the 4 different kind of vaccines which are out there. And I'm going to just briefly talk about one by one. So the first one is, which is a genetic code vaccine, and which is like Pfizer vaccine or BioNTech or Moderna vaccine. And Dr. Naidu and Dr. Madhu will talk a little bit more about it, but this is basically a very noble genetic code vaccine. It is a first time cutting edge technological approach was taken. In fact, we have known about this thing for the last 30 years, but there is no other vaccine which has been approved as an mRNA vaccine. And what it does, it uses your genetically engineered RNA to generate a protein that itself safely prompt an immune response. So that is the first vaccine that has like Moderna or Pfizer. Those are the 2 vaccines available at this time. The second vaccine is a viral vector vaccine. And you can see AstraZeneca and J&J. They are the company which are coming up with the vaccines. So which uses a vector virus like adenovirus that has been genetically engineered already so that it cannot cause disease. But it produces the coronavirus protein to safely generate an immune response. So that is the second virus, the second vaccine. The third vaccine, that is a subunit vaccine or like a Novavax, which is a protein-based subunit vaccine which uses harmless fragment of protein or protein cells that mimics the COVID-19 virus to generate immune response. And the Novavax is the vaccine that is coming out, still not approved yet. And the fourth vaccine that we all know about is basically inactivated or weakened vaccine, which uses a form of virus that has been inactivated or attenuated or weakened, so it does not cause disease, but still generate an immune response. And there are two vaccines which is still in the pipeline. They have not been approved yet. That is called Sinovac or Sinopharm. So far, there are 13 million vaccines have been given worldwide. And Pfizer, Moderna, and AstraZeneca, these are the 3 big vaccines available in USA as well as in European country. And they have predicted a manufacturing capacity of 5.3 billion doses in 2021, which would be sufficient to vaccinate about 3 billion people worldwide, as vaccine requires 2 doses. So these are the basic introduction about, and the next slide, please. So again, Dr. Madhu is going to talk a little bit more about this one in detail, but there are three comparison of the vaccine. One is called Pfizer-BioNTech, which was first approved in the United States about 3 weeks ago. There is a second vaccine that is Moderna vaccine, and the third one is AstraZeneca Oxford vaccine. The efficacy you can see is 95% with the Pfizer, 94.1% with the Moderna, and 70% with Oxford vaccine. And the first two are mRNA vaccine, the base vaccine as we discussed earlier. And the second one is a vector vaccine that they have used the adenovirus vector in there. And again, I will let Dr. Madhu talk about the shelf life and how to administer it, but both these vaccines have 2 doses and they are given 3 to 4 weeks apart. 3 weeks for Pfizer and 4 weeks for Moderna and AstraZeneca. And so these are the bottom line, these are the introductory point that I would like to make. And then at this point of time, I will just pass it on to Dr. Madhu, and we will let him discuss a little bit more about the Pfizer, about the vaccines.
Thank you, Dr.
Thank you, Dr. Prasad, and thank you, Pat, for the generous introduction. Good evening, everybody. And next slide, please, Madhu. So I'm going to talk more about the Moderna COVID-19 vaccine, which I had the fortune of working over the past couple of weeks and share some experience among our patients. Next slide, please. So as Dr. Prasad had mentioned, the differences between the two vaccines, one is both are 2 doses and given 3. One is, I'm not going to talk much about the Pfizer vaccine because it's basically difficult to store, and most of the hospitals are the ones which have been administering. But for smaller clinics like mine or any other pharmacies, I think the Moderna vaccine is easier to store and distribute as well. To go into a little bit the process, actually, Texas State Department of Health Services had a lengthy process. All the physicians or all the pharmacies out there, and after rigorous seminars and training, we received we were allotted about 500 doses of vaccine to our clinic in the second week of allotment of this vaccine in December, which was right before Christmas. And each vial, what we call a bottle of vaccine, comes with 10 doses. But it can, if we are really good enough, and we can sometimes extract up to 11 to 12 doses, depending on how somebody is drawing. And as far as the storage, a little bit to know about, this can be stored in the regular deep freezer of regular freezer of the refrigerator for up to actually 6 months at a temperature of, between 25 degrees centigrade to negative 15 centigrades. And at a temperature of 2 degrees to 8 degrees centigrade, it can be stored up to 30 days. Now, typically what we do is once we take out whatever, based on the number of patients here, our subjects or people who are scheduled, we take out 1 vial, and it is stored for a few minutes, quarter hour or so. And then once it is stored, then it has to be administered within 6 hours if it is punctured. So if I start vaccinating one person, I have to, from 1 vial, I have to use up the rest of the doses within 6 hours so that the vaccine is not wasted. Now, if you don't use the vaccine and it is left at room temperature, it is pretty safe for up to 12 hours to be used. So this is just a little bit about the storage and the indication. I mean, it has been, unlike the Pfizer-BioNTech vaccine, which has been approved for 16 and above, Moderna has been approved for persons aged 18 and older. And they receive 2 doses, although it's 28 days. Usually you can start from 24 to 28 days. and the Pfizer can be given between 70 to 21 days. But sometimes people ask me, what happens, if I miss my dose after 28 days or 21 days, can I get it? There is no set limit, but the efficacy goes down gradually. So they recommend you can still get your second shot as soon as, even if you pass the day for whatever reason it may be. And the most important thing, you cannot mix and match these vaccines. So if somebody got the Pfizer vaccine, it is recommended that they get, so far at least what we know. This may change. As UK, we have heard that they want to try the mix and match, but at least in the US, we have stuck to the same vaccine to be administered as the first dose as well as the second dose. And there was a question, now when we got this 500, do we give 250 patients and then keep the rest 250 for the second dose? But the state has allowed us that to use up these 500 doses right away, and then they were going to send us the second round when it is up due. So, and the other difference between the Pfizer vaccine is it has to be diluted, whereas the Moderna vaccine, it comes as a ready mixed vial, and you just draw it and give it intramuscularly over the deltoid area. So next slide, please. Let's talk a little bit about the side effects, which most people are concerned about. And actually, I think that is one of the purpose of this, the talk is to educate our community about the side effects and inspire or instill confidence that these are pretty safe. And so far, since the vaccine, I think we have vaccinated probably more than 4 million as for the last count, but we may be behind with that. There's probably more than that. And I think in Texas, we have vaccinated about 326,000 people, which is kind of very slow compared to what our goal was. The initial, we started out with a big goal of to vaccinate 20 million people by the end of December. But due to various reasons and the vaccine coming out right before the holidays, and then again the distribution process, people getting used to it, I think we are just learning how to circumvent that. Now that we are into 2021, the process has been accelerated, and getting the vaccine to every person who needs it. So the first dose typically, as in our, we have almost given about 570 doses, and most people start out complaining of a little bit sore arm. That's the most common complaint. But in the younger folks, actually, who have a robust immune response, you're likely to see a little bit stronger reaction like muscle or joint pains, headache, more often, and fatigue. Whereas a little bit elderly people, you see more little soreness at the injection site. And again, after the second dose is what I would really say, if at all somebody experiences. And in fact, in the trials, they have recommended, especially the younger people, if needed, to take off so that they're not surprised. They may have a little bit fever, fatigue, chills, headache. Those are again the same similar side effects with like flu-like symptoms with any other with the first dose, but a little bit more intense, I would say. Mm-hmm. And a lot of people ask me, can I take an anti-inflammatory even before the vaccine? They recommend not to do it, but if you develop symptoms, you can definitely take any of the anti-inflammatory, which will help with the subduing the effects, what we see. Now, let's go to the next slide. So the first round of vaccination was meant for the healthcare workers, and the CDC guidelines that goes in. Again, each states have been given their own flexibility of vaccinating to whom to start with, like the essential workers, healthcare, teachers, pharmacy, emergency responders, EMTs, and again, the next people in line to be considered the increased risk for the severe COVID infection, like 65 and older, long-term care facility resident, people with pre-existing conditions like COPD, diabetes, coronary artery disease, and other immunosuppressed conditions. There's increased risk of, in the especially the COVID infection in the racial and ethnic minority groups, incarcerated population, and students attending university. Next slide, please. So I think it's very we give it to all our patients. Are the people who are vaccinated. Sorry, I shouldn't be calling them patients. They're healthy people, and they're supposed to register to this VSafe. It's an app you can download on your phone, and right from day one, you can report how you're feeling up to 7 days. It gives a prompt to enter how you're feeling, and after that, it's every week they monitor for side effects, and you can put in anything, whatever you're experiencing. Now, a lot of people have questioned, based on my experience over these couple of weeks, I have had no major side effects among our people, and except we had, I think 3 days after the first dose, I had a family which reported that they were experiencing some side effects. One of the persons actually had developed fever, and somebody else had cough. So I said, this doesn't sound like a typical side effect, and recommended to get them checked for the COVID, and they did test positive. So what is important for us to realize here is that people are coming to get this vaccine maybe in the incubation period. They may be asymptomatic, and they probably develop the symptoms right after the vaccination. And we tend to falsely blame it or attribute it as a side effect of the vaccine because you don't know. You're thinking, oh, I took this vaccine. This probably is what is causing my symptoms. But that is where I think anybody who gets a vaccine, if they experience, they should contact their physician who can determine whether it is vaccine related or they need to be further checked for COVID. Now, the good thing, a lot of people again ask after the first dose, what is the efficacy? And at least for the Pfizer vaccine after the first dose, after 10 days, it has been reported that 52% efficacy. That means the chances of developing COVID was reduced to in that population about 52%. And Moderna, we don't have the exact numbers, but they say that it can be up to 80 to 90%. It goes as high as 80 to 90%. So, in fact, there was a talk about spreading the dose between the doses if it is so high in terms of reducing the virus transmission. And the second thing, I think earlier Dr. Naidu had mentioned, you'll be talking soon, actually, I'm sorry, and where even if somebody gets the COVID infection, it's 100% effective in reducing the severity of symptoms, which makes it all the more important of getting vaccinated. So I think having said this, I will pass it on to Dr. Naidu.
Thank you, Dr.
Thank you. Thank you. Good evening. We had a very brilliant talk with these two young physicians. They were very clear. One thing I'll tell, we have two vaccinations here, Pfizer and Moderna. They all block 100% getting very ill so that you won't be hospitalized when you get the vaccine. That's number one. And also they are very effective, not like before some of the vaccines. And if I get a chance, I'll take the first one I get, whether the Pfizer or Moderna. So if I offered one, I would get it because a day sooner means a day sooner you will have immunity. Is that important? When you take a vaccine, you will dramatically reduce the risk of getting virus and also eliminating the chance of being hospitalized. These things one need to know. This is not like previous vaccines. I will talk to you about how they are made, why they are different than other vaccines like mumps, measles, polios, all the previous vaccines, why I am so upbeat about this vaccine. This technology is a brilliant at science level. That's one thing I can tell you. It may get Nobel Prizes on this. It is a mRNA technology, which is, I'll explain in 2 minutes. It's a milestone in science, medicine, and history. There is no doubt. It's a new platform of technology. I can tell you, it's a huge day for a science, this technology, not only for vaccinations. There is another one coming to prevent heart disease, vaccine once a year, mRNA technology, and it will be going to be approved shortly. It is success with this vaccine in unprecedented, beating all odds. Good day for science, I can tell you. And this vaccine is the only way, only pathway to end pandemic. I took myself, didn't have any reaction, and I'm going to take mine in few days. How this is done, I will explain to you. One word, when you are exposed to a flu, that is an antigen, comes into your cell, your body reacts to produce antibodies to fight it. But there is a time lag to form antibodies. In the time lag, virus replicates. Then this virus produces antibodies in the body, and they pass the memory to other ones. Next time, when this stupid virus comes, they realize, okay, you are coming, I'll fight on you. That is the antibodies. Then what is this mRNA? mRNA is a part of DNA. DNA is a blueprint for all the cells. The mRNA is inside DNA. It gives messages to the body, go and do this. And this mRNA is a sequel of a lot of proteins. These guys, scientists, they found out one spike protein, which is very important in this mRNA. They knew the antibodies will be formed mostly for the spike protein. Thus the software genetically engineered to spike that bit of the protein, and they put it in the saline in Pfizer and injected into the muscle. And that formed 3 spike proteins together. And that's the one which induces antibodies. Next slide. The Pfizer and Moderna use mRNA in their COVID-19 vaccine. This never before used technology could transform how science fights disease. Therefore, it is safe, effective, and we had this platform before, and rightly they used in 8 months to produce the vaccine. That speed ramp was done because we put the dollars to bid different companies. Pfizer company, Moderna company, AstraZeneca, because we need so many vaccinations. This country, we need 1 billion injections. It's a Hercules task. Next slide, please. This is the same thing. It's a DNA, and RNA is coming. RNA got a sequel of proteins. And they found one protein called spike protein in the middle. They can extract it genetically. And then in saline started injecting. Next slide, please. This is the way it works. This is the virus with spikes on it. That's a SARS-CoV-2 virus. It produced, and from the DNA, we extracted messenger RNA. That's the one. That messenger RNA was put into nano butter type lipid molecules so that they become stable. You cannot give it, it goes around and get destroyed. That nanolipid particle will be injected. That lipid particle can stuck to the DNA inside. Then the DNA think some guy is coming who is a stranger. Let me deal with it. And that DNA send a messenger, produces the protein. That protein goes to immune cells like B cells, macrophages, produce a temporary antibodies, and also pass the memory to T cells. That means anytime when it comes, they fight. This guy is stupid, is coming, I have to fight it. And that is called memory. B cell memory is a short term. When you get T cell memory, it could be 2 years, 3 years, 4 years. But we don't know what immunity we are getting. That time only will tell. But at least the way they are binding, scientists believe that it will be about 2 years. Therefore, you may need a booster shots every 2 years, we hope, or every year, mix with COVID vaccine and give it. That is the technology. Why I am so much upbeat on this technology is, this is not like vector. We are not injecting a adeno flu virus into the body, which may have more side effects. This is mRNA, which is neither give the blueprint, nor give the DNA, nor cause any long-term effects. And it is the first time ever, 95% efficacy, one has shown in about 70,000 patients, and 100% getting very, preventing the hospitalization, preventing very ill. Thank you.
Thank you very much. It is great information. But we're getting lots of questions here, so we're going to jump right in it. You talk about getting the vaccine and how the vaccine makes antibodies. Andrea Valero texted in and she said, well, if you've already had the virus, you have the antibodies, so why would you need to take the vaccine?
Okay, I'll tell you what. When the virus comes in antibodies forms, it takes some time. There is a time lag for forming the antibodies. During the time lag, there is overrun of replication of the virus. They will win before you get the immunity. Even the immunity, the macrophages, before they come, if your immune system is still working, sometimes it go overdrive, the immune system. Cytokines producing called CD4, CD8. And that really causes more problem. Not able to fight. They want to fight, but the virus overtakes it. Therefore, that time lag and replication, that balance goes out of rhythm.
Okay. One question too, that I think a lot of people are kind of overwhelmed with, okay, when can you take it? For example, let's say one person has already asked the question: if you've had COVID and you recovered from it, how long do you have to wait before you can get the vaccine?
If we have a COVID, normally 3 months CDC says. The reason they say 3 months is so that they have antibodies temporary from the B cells. Therefore, that instead of wasting the vaccine giving in a month, they said, let us give 3 months time. Or if you have taken monoclonal antibodies, like our president took it, then definitely you need to wait 3 months. That's the time CDC recommendation. But probably if you have it, you can give a little earlier. There is no definite rule on that. Is that right, Dr. Madhu?
Yes, sir. I think it's a gray area there, and we need more evidence. We are learning every day, as Dr. Naidu rightly put it. The way I look at it is, if somebody has got some antibodies and CDC is saying, wait, why not we wait and use this vaccine to somebody else we can to prevent this illness who has not had the infection rather than somebody who's had some antibodies, some protection is the way to look at it is what I think.
And also, when you have the COVID, you don't develop neutralizing antibodies. They are very important. What you develop is a general antibodies. They are different. Therefore, to prevent the disease, you need to have neutralizing antibodies, not the general antibodies. So everyone who had the virus need to get this vaccine to build neutralizing antibodies. We still don't have to measure the immunity. To measure the T-cell immunity, it's not easy. Therefore, you cannot issue an immunity card or you are immune for life. You cannot until you check for T-cell immunity. Thank you.
So what about, let's say I'm going to go get my shot and maybe I have COVID and I'm asymptomatic. I already have it. I don't even know I have it and I'm going to go get my shot. Do I get the shot? And if so, what happens?
If you are still symptomatic, you have to wait.
But if you don't even know if you have it, let's say you have it and you're asymptomatic, so you think I'm perfectly fine.
You can get it.
Okay.
It will prevent the virus disease, prevents getting it very sick, prevent your hospitalization, but you still may have a viral load in your nose. You can transmit to somebody else, even though you had a vaccine. Therefore, prevention with you is okay, you're okay. Still you need to use the masks, distancing, washing, all these things you need to do because we still don't know if your viral load can give the disease to somebody else.
Right.
Except the AstraZeneca vaccine, they say they can prevent transmission. But these other two, they're not very sure about it.
Right. So what about, people are having some questions about, let's say I go in and I take some other routine vaccines for I go in and get my flu shot, or I go in and get my shingles vaccine. Do I have to wait after taking those before going to take my COVID vaccine? And if so, how long?
Once if you take COVID vaccine, you have to wait 14 days. Am I right, Suresh?
Yeah.
Do you?
Yeah. Yes, sir. So Dr. Naidu rightly said, I would recommend to wait for 14 days after any vaccine. Like suppose if you're going to get a shingle vaccine, I have my personal experience. When I took my shingle vaccine, I had a lot of soreness, low-grade fever, malaise, body ache. Those are things can happen. So sometimes you would not know which vaccine is doing what. Suppose if you're taking two vaccines simultaneously, and I have seen several patients in my practice, they will say, well, I took the tetanus shot here and pneumonia shot here. Now I develop fever. So you do not know which vaccine has done the reaction. So I would definitely recommend to wait for 2 weeks to wait for the vaccination.
For example, I took the vaccine today for my allergies, which is called a biological drug, 14 days after the COVID. And also, if you are taking a lot of other medicines, ACE inhibitors, blood pressure medications, and the answer is uniformly there is no interaction with medications with this vaccine, because this vaccine is not a live vaccine. They don't interact with other medications. You should not have any doubt to take this, even though you're taking many other medications. This is just not a live vaccine. They don't interact.
Right. So I'm going to throw a quick, Janice Edwards, one of our viewers, and I think this is something that we ought to talk about, because, you know, these new vaccines are going out. And of course, with that, all the rumors and the, you know, scary tales that you hear going around. And Janice Edwards has a question. She wants to throw it to Dr. Prasad first, but she says, you know, there are people that are afraid to take, she's heard that are afraid to take the vaccine because of the talk about it changing DNA and making people susceptible to disease, and also because it's been said that the vaccine contains human or animal DNA. Are any of these statements valid and kind of help people understand that
no,
why they don't need to worry?
Absolutely not. And Dr. Naidu has shown the slide, and again, that was assigned to him to show how the mRNA technique and technology works. And it has absolutely no reason to worry about. There is no live vaccine, as Dr. Naidu had said times and again. We have taken the RNA and genetically engineered in such a way that it produces a response inside your own body by producing the antibody. That's what it is. So just think like that you are taking a medication, and it has produces some antibody or immunity against some particular COVID virus. But it does not change your DNA. It does not go into your DNA, because this does not go into nucleolus.
Right.
If you will look at the whole, like, you know, I wish I could have explained a little bit more by showing the slides, but once you take the vaccine of mRNA, it stays in your cytoplasm, and that's where ribosome, that's where they start producing some antibody against the COVID virus. So it does not even go in your nucleolus. That's where the DNA is seen. So no, absolutely no change in your own personal DNA or any other DNA.
Okay.
Dr. Naidu, would you agree?
That's true, because this is not a DNA which gives a blueprint.
No,
Messenger RNAs come like a shred all the time, like your email. They're coming on messages and you're spreading. They're not going to stay in the body. Therefore, it's absolutely not right.
No.
It causes a GP syndrome. It could be given in chemotherapy patients. It could be given in cancer patients. It could be given in autoimmune deficiency patients. They should have no problem to give this.
Yeah.
Right.
Like, sometimes we worry about giving live vaccine. Like, you know, there was a vaccine called Zostavax, which has a live attenuated vaccine. So we were not giving it to the patients who were cancer patient, HIV patient, lymphoma patient with low immunity, because it's a live vaccine, so they can have a hyperimmune response.
Right.
How these vaccines, two vaccines that we are talking about tonight, mRNA vaccines, they have absolutely no virus, period. It does not cause any immune response except having some change, like, you know, mRNA produces some immune antibody specific to a spike virus that Dr. Knight has mentioned about it. So,
Dr. Madhu, what about, are there people that should not take the vaccine at this point? For, you know, if compromised immune system or suffering from cancer, are there any categories that they're advising, no, you don't take this vaccine at this point?
I think, again, like Dr. Naidu mentioned and Dr. Prasad mentioned, absolutely. Currently, there is no contraindication, or people with cancer can take it. Even the kids, usually only for Pfizer, it's 16 and above, and 18 and above for the other people. Now, there is a question about people who are pregnant. Even pregnant people can take it. It's not absolutely contraindicated.
No.
If their obstetrician, whoever is their doctor can agrees that it's a, you have to look at the risk of the virus versus vaccination. So it's at the discretion of the physician. They can still get vaccinated even when they're pregnant. Same thing when they're lactating.
Right. Okay. And talk more about, there may be some people that think, okay, I got the vaccine. Now I can walk around without wearing my mask and live life large again. It's not that simple, is it?
No, it is not. Earlier we come back again, like Dr. Naidu had mentioned. The main issue is, yes, after the vaccine, I am protected, but there's chance that I will still be transmitting the virus because it can be in the nose, sitting in the nose, colonized, and I could be transmitting it to somebody else and spreads in the community. So we don't want that, and that's the reason why the mask still is a necessity even after the vaccination.
That's a good point.
So, yeah, with this fast-moving pandemic, no one is safe unless everyone is safe.
Right.
Yes,
that's a good point.
And as Dr. Madhu was saying, you could be protected against the virus, so nothing will happen to you. We're not going to get symptoms of it after a few weeks of getting the vaccine, but you can still carry some viruses in your nose, and you can transmit it to your loved one. And as a physician, we always tell the patients, you are not, because I see some young, they will say, why do I need to take the vaccine? I said, don't worry about yourself. Think about somebody else. You can transmit, you can carry those viruses. You may be asymptomatic. Like 40% of the patients, 40 to 45% of patients are asymptomatic. They do not have any symptoms. Like I saw one patient who came to see me and for something else. And she said, well, by the way, my mother was sick with COVID. Should I get tested? I said, it would be a good idea to get tested. She goes to the hospital, get it tested, and she was positive. Even I was exposed with that patient too, right?
Yeah.
But patient has no symptom whatsoever, but so 40 to 45% of the patients are asymptomatic, but they can be carrier. Even though you're vaccinated, you can be carrier. You can give it to your loved one, you can give it to your friends, families, and other people. So as Dr. Naidu said earlier, still you need to wash your hand, you still need to put your mask on, you still need to maintain a social distancing till this pandemic is over.
Right.
See, we have 22 million people affected in this country with COVID. They're all diagnosed. Undiagnosed, we think at least 70 million people.
Yes,
About
sir.
100 million people probably been affected.
Agree.
Wow. So, Dr. Madhu, since your clinic was part of the kind of the rollout, getting the vaccines out locally, talk more about kind of the system that y'all use to kind of identify who gets it first. Because I know there are a lot of people asking, okay, when can I get it? When will group 1B get it? And talk more about the categorization and the process and when people can expect and where they go also to try to get the vaccine.
Right. That's a very good point. And all of us are looking for an answer for this. When am I going to get my next and who is in priority? And like I mentioned earlier, we started out with the healthcare workers, then there are different categories, then the EMTs, and then the teachers, the educators, and then the 65 who are high risk, 65 plus, and then not only 65 plus, but even people below that age with comorbid conditions like diabetes, asthma, COPD, anybody who is immunosuppressed, they all are in the priority before the other people. Now, I'm sure some people have seen, hey, I know this guy, he didn't have anything, he got the vaccine. But what happens is, as I was telling you earlier, usually in my clinic, when we were scheduling, we had 10 doses I could not schedule 12 people because if I schedule 12 and then I end up with 10, what am I going to tell the other two people? So we could schedule only 10 people, and then the 2 other doses, I said, if somebody can be on a standby, I said, whoever can come. If somebody who meets the criteria will come in, nothing like it. Come on, we'll give it. But if somebody is not ready and somebody says, okay, my brother is here, or my spouse is here who doesn't need, but since the goal here is, again, the vaccine should not be wasted.
Right.
So although it was rolled out as to be given in that particular order, it doesn't mean, the goal was to vaccinate as quickly as many people as possible. At the same time, not missing the people who need them.
Mm-hmm.
I hope.
Well, and I guess that was part of the issue in the first weeks or so. And I guess the state health department even kind of sent out an edict to healthcare people saying, look, don't get too much in the weeds over this. You need to make sure you get it out with all due haste. And,
right. And that was what happening when it came out. Everybody thought they were looking just in that box. Okay, they told me I have to go in this order. Whereas I have seen in the newspaper, like where the doses were wasted because they thought they didn't schedule people, and then those were meant for only those people. Whereas every drop counts is what we should to save lives is the way to look at it and fastly move on. Whoever is available, whoever is willing is what that's where I like this Texas State Department of Health flexibility.
Mm-hmm. So where do people go to find out kind of when and where they can get a vaccine? I know I think today ORMC was distributing vaccines, so help people understand where they can go maybe to find that out.
I saw one of the pharmacies again was this, which was Sunflower Pharmacies, who I saw who started to give out to the public as well today, which is excellent, in it, because we ran out of our vaccine pretty fast. I think we have to look at which sites. The State Department has got a website, who is being allotted, how many vaccines. So those are the places to look for. Like HEB Pharmacy, I know Dr. Prasad was looking for somebody for the staff, and HEB Pharmacy had luckily got the doses. He had called them up, and then they could. So I think we just have to see who got the doses and find out. And
Pat, that is your work to find out through the health department, through the hospitals, to put a list in the newspaper where to go for it.
Okay.
People are confused. I tell you, I had about 40, 50 calls to my office. Somebody has to take the responsibility. Hospitals, newspapers, health department, somebody has to do it for community. We have a problem here.
Mm-hmm.
I saw in the cold weather, 200 people standing before on their feet, 75 plus people. I don't think I can do that. Why can't they do it sitting in the car?
Right.
Why can't they open the ERs day and night, both hospitals? And I am very sure we have produced 20 million supposed to produce, haven't even given 4 millions.
Mm-hmm.
You think we can do all the vaccinations in a year? I doubt it. Companies are not doing their work, and distribution is not working right. And also getting into the arms are not going right. I think we have a problem here.
I think Dr. Naidu was rightly said. The main thing, we produce this vaccine with such a speed, but we are hitting hurdles here in delivering it to the arms. So that is where I think all of us need to work together and get it out as quick as possible.
So let's talk about, because in the news, not only are we hearing about the rollout of the vaccine, but we're hearing about the mutations of the virus that are popping up. And I think people are asking the question of how bad is that mutation? Is it something they really need to worry about? And also, does that mean that the vaccine I get for that's not going to be any good, and they're going to have to, they're going to have to tweak it? Help us understand more about the mutation and how that works juxtaposed to the vaccine that's currently going out.
The mutation is a normal thing. If a flu vaccine is there, it mutates all the time. Therefore, one vaccine for flu this year is different for next year. Even the same year, they mutate 3 or 4 times, can change. But in this virus, according to the scientists, we can block this mutation because the protein they extracted is so strong, it can put all the mutating varieties. Therefore, that spike protein is a strong combined capacity is there. Therefore, they think they're very sure about it, that this vaccine is going to work. For one problem with mutation, it can spread easily. It can make people to get the disease easily, but they don't get very sick. Children get it more, this mutated virus. But this vaccine, all the vaccines we have, 4, they do work.
And there was a data from England about the AstraZeneca Oxford vaccine. And because their first patient from mutant COVID 2.0 was found in England, and then some in South Africa. We have few patients reported here in United States as well. AstraZeneca came out and said, my vaccine works against the mutant virus. So as Dr. Naidu said, we do not have enough data so far, but we are hoping, and most of the vaccines that is available, like all the Moderna and the Pfizer, would continue to work against the mutant variant as well.
Okay. Real quick, someone asked, they wanted to see the slide showing the efficacy rate. I don't know if we have time for that, but just for the record, Pfizer is 95%, Moderna is 94.10%, and AstraZeneca Oxford is 70%.
Right. Yes, 60 is good enough for approval.
Right. Dr. Madhu, I'd like to get your kind of a personal take from you on all of this, because in the early days of the virus, before it really started to flare up in Odessa, I know your practice was hit really hard with a lot of your staff getting sick, and you even lost one of your members, and y'all had to really take a lot of drastic steps early on. And having gone through that, and now being in a position where, I guess it was 2 weeks ago, your staff is there being able to give out, local practice, give out those doses. What were the feelings that were going through you and your staff members when y'all were doing this, having gone through everything in the first place?
Yeah, it was definitely overwhelming, and like a lot of people, my patients, when they came, they said, I have tears in my eyes. I have been waiting for this day. And I felt the same way. It was like, if I had made it to this time to get this vaccine, that's a blessing, so that we can continue a new lease of life. And that was the reason, in fact, our team actually worked on the weekend also to make sure that we get this out despite the holidays as quickly as possible, so that in our community, the way it is spreading, at least we can slow down a little bit of that,
That's great. I know y'all been through a lot, and that was really neat to be able to do that. A couple of real quick questions, and then I think we're going to have to wrap this up. But one is, and these are just kind of, will there be a vaccine for children?
Yes, the reason is in USA, we don't do any trials on children until we finish the trials in adults. That's why they did not do any trials on children and pregnant women. And there are some data, Pfizer, about 12 years, I was told it will be coming. But afterwards, they do the trials in children. Because of the past history, thalidomide and all those things, we just don't start the trials on children. We start with adults and then go to the children. Now they're going back to 12, we have the data. Then they go back to 2 years or above. That's the way the trials are done.
Okay. And then, for example, if you're a new mother who's breastfeeding your child, should you take the vaccine?
Yes.
Okay. Okay, great. That's good to know. And one more thing, because you talked about you get a batch and you gave the batch out, and then 3-4 weeks later they come back for the second shot, and at least one person's asked, will there be enough for the second shot? I mean, is that all planned properly?
Absolutely.
Well,
Yes.
so far, the state seems to have provided the necessity. They're kept on the shelf for all these people. It's only a question of shipping them as soon as we exhaust. So we are assured of that, yes, today.
Okay. So what I think we would want to do now is we're up on our 1 hour mark. And so what I'd like to do is throw it to each of you for some closing thoughts. And we'll start with you, Dr. Prasad.
Well, first of all, this was very well received, and thank you, Pat, and thank you all the panelists as well as Ravi for doing this. And we have suffered a lot in 2020, and I'm hoping that in 2021 we need to change a consciousness. Let's all shift from fear to faith, blame to responsibility, irration to patience, competition to cooperation, and comparison to compassion. And I think we will all succeed. We will beat this virus as we have done. And this is the best place in the world, as I said earlier. And we will definitely win this war against this COVID virus.
Thank you very much. Dr. Madhu?
Yes, I totally echo what Dr. Prasad has said. Thank you, Pat, and the audience questions were excellent.
Yeah.
What we all face every day, they brought up very important, and as well, you have brought up several things which, so we really appreciate that, and I hope this is going to inspire and instill more confidence in our community, so that the vaccination rate will go up, is what I hope in 2021, as Dr. Prasad said.
That's great. Dr. Naidu, I'm sorry.
Yes, sir. This technology in a new platform is the milestone in science history. They should believe it. And it's very effective, safe, and also it decreases the viral load and transmissibility as the time goes on, and give the herd immunity, which we all wanted. Therefore, it is the only pathway, vaccine, to prevent the pandemic. Even after vaccine, it may take next summer before you get rid of your mask, washing the hands. Keep that on. And thank you.
Thank you very much, Doctor. And thank you, all three of you, for joining us. I appreciate all the knowledge you've brought to the table, but also more importantly, the fact that y'all treat us all in this community. You take care of the sick. You've helped us weather this pandemic, and we can't thank you enough for your service and the care you've given this community. And with that, I'm just going to say, if we could all continue to socially distance, wash our hands and wear our mask, and I'm going to toss it to Ravi to wrap things up. Thank you very much.
Thank you, Pat. And first of all, thank you, Dr. Naidu, Dr. Prasad, and Dr. Madhu. You are giving us a lot of peace of mind for many of our community members. You always do that in your practices, but I think in this environment, there's a lot of unanswered questions. I think taking time to do that we are very grateful for that. And Pat, I don't think anybody can convey everybody's thoughts and concerns better than you can. So we do appreciate you for taking the time, and you're also getting all our thoughts together in a way that it makes it all of us sleep a little bit better tonight. That's all it is. So again, as Dr. Prasad said, the compassion is there in our community, and as it is evident here. So we wish to thank you, and also for all the attendees who joined us today and asked some very good questions. Please share this information with your friends, families, and neighbors to give them some peace of mind that there are answers right here. So please, looking forward to a better 2021. And just in closing, like to say our last session on COVID will be next week, and we'll have the future, the Texas Tech residents who will be taking part in a discussion. So please keep an eye out for that. And with all that said, thank you very much, Pat, Dr. Naidu, Dr. Madhu, and Suresh. Thank you, sir. Have a good
Good
night.
night. Thank you, John. Thank you. Good night.
Bye-bye.